As you near the end of your pregnancy, one question can become all-consuming: vaginal birth or C-section? What is the best and safest way to bring my baby into the world? Welcome to X-HEALL, where we bring clarity to your health questions. This choice is surrounded by strong opinions, social pressure, and sometimes a lot of judgment. But here we believe in one thing: empowerment through information. In this video, we're going to break down both paths. We'll explore how they work, the real medical reasons for a C-section, the benefits and risks of each, and what you can truly expect during recovery. Our goal is to give you the knowledge to have a confident, informed discussion with your healthcare team. Let's understand each journey. Both vaginal birth and C-sections are safe procedures when properly indicated and performed by qualified teams. The most important thing is to ensure the health and well-being of both mother and baby. First, let's talk about the vaginal birth, the physiological path. This is the natural process where the baby is born through the mother's birth canal. It typically begins spontaneously between 37 and 42 weeks of pregnancy and progresses in phases. The phases of labor are dilation. Your cervix gradually opens with uterine contractions. This is usually the longest phase. Pushing. At full dilation, around 10 centimeters, you'll feel the urge to push to help your baby descend and be born. Placenta delivery. After the baby is born, your uterus continues to contract to deliver the placenta. Throughout labor, you are the protagonist. You can move, change positions, and use powerful pain relief methods, from non-medical options like a warm bath and breathing techniques to the highly effective epidural analgesia, which allows many women to rest and focus. When there are no contraindications, a vaginal birth has several advantages. These include a generally faster maternal recovery, less time in the hospital, and a quicker return to daily activities. There is also a lower risk of infection and hemorrhage compared to a C-section. For the baby, passing through the birth canal can help expel fluid from their lungs and promotes the colonization of their gut with the mother's beneficial bacteria. Immediate skin-to-skin contact is often easier, which benefits bonding and breastfeeding. Finally, it carries fewer risks for future pregnancies. However, there are also potential challenges. The duration of labor can be unpredictable and long. The pain from contractions is significant, although manageable. There's a possibility of perineal tears that may require stitches, and a small risk of complications that could lead to the need for an unplanned or emergency C-section. Now let's look at the Caesarean section, or C-section, the surgical path. A C-section is a major abdominal surgery where your baby is born through an incision in your abdomen and uterus. It can be medically necessary, whether it's planned in advance or happens as an emergency, or in some cases it can be elective, based on maternal request after a thorough discussion of the risks and benefits. It's typically done under regional anesthesia, like an epidural or spinal block, so you are awake to meet your baby. The primary advantage of a C-section is clear: it saves lives. It is absolutely essential in situations where a vaginal birth poses a significant risk to the mother or baby. For planned C-sections, the predictability of the birth date is another advantage. And for some, respecting patient autonomy is a key benefit, particularly for mothers with an extreme fear of childbirth, known as tocophobia. As a major surgery, however, a C-section has disadvantages. It carries surgical risks like infection, bleeding, injury to adjacent organs, and anesthetic complications. Maternal recovery is typically slower and more painful compared to a vaginal birth, requiring a longer hospital stay and careful wound care. There's also a higher risk of respiratory complications for the baby, especially if the C-section is elective before 39 weeks. Lastly, it can increase risks in future pregnancies, such as issues with the placenta or uterine rupture. The World Health Organization states that C-section rates around 10 to 15% are associated with better maternal and neonatal outcomes at a population level. However, what matters most is the right reason for each individual. When medically indicated, a C-section is a life-saving tool. So, what are some of these medical reasons? They include fetal distress when the baby is not tolerating labor well, placenta previa, where the placenta is covering the cervix, an active genital herpes outbreak at the time of labor, cord prolapse, and sometimes a history of previous C-sections can be an indication, though many women can safely have a vaginal birth after a C-section, or VBAC, which is a topic for another video. It is your right as a patient to receive all this information. Your birth plan is a great tool to start this conversation with your doctor or midwife. Their role is to combine their medical expertise with your personal values and circumstances, guiding you to the safest decision for you and your baby. An open, respectful dialogue is key. So, vaginal birth or C-section? There is no single best answer. The best birth is the one that gets you and your baby safely to the other side, conducted by a skilled and compassionate team in a way that makes you feel respected and cared for. Getting informed, talking openly with your provider, and understanding your rights are the key steps to an empowering birth experience, no matter which path it takes. What are your thoughts or experiences? Leave a comment below. Your story enriches our community here at X-HEALL. And if this video helped you, please like, share, and subscribe for more clear, evidence-based health content. Thank you for watching.